Someone with type 1 diabetes, can they take vitamin D and vitamin K? I had said earlier that people with diabetes have been found to have low vitamin D levels. So this would be a good reason to have a vitamin D level checked by your provider if you've been diagnosed with diabetes. What's more important in someone with type 1 diabetes, that is actually an autoimmune syndrome. And autoimmune syndromes travel together. And one that very commonly is seen with people with type 1 diabetes is celiac sprue. And that's where you have an allergy to gluten. You cannot tolerate anything that has gluten in it. By ingesting gluten, you have diarrhea and you malabsorb a lot of vitamins and minerals. And one of those is vitamin D. And so people with celiac sprue usually have a lower vitamin D level. So I always would recommend that someone with type 1 diabetes also get antibodies checked by their provider to make sure they don't also have celiac sprue. Vitamin K. Vitamin K has actually been found to help with insulin sensitivity. And I love these questions, guys, because you're making me do research and freshen up my knowledge. So it has been shown to reduce the risk of diabetes and improve insulin sensitivity. They think it supports blood sugar control by enhancing insulin secretion and sensitivity. Only thing with vitamin K to warn about, but in someone who's young with type 1 diabetes, I would assume they wouldn't be on any medications for blood thinning. That's in people who've had blood clots and they are placed on blood thinning medications like Coumadin. Those medications are really affected by vitamin K. So again, whenever you're starting a supplement, really talk to your doctor about it. But the vitamin D and the vitamin K should be absolutely safe in someone with type 1 diabetes. Of caution, if you are going to start supplements such as vitamin D or vitamin K that can affect blood sugar levels, especially in someone with type 1 diabetes, they are on insulin and they can never get off insulin. They should check their blood sugars more frequently to make sure that their insulin dose doesn't need to be changed. Because you can imagine if you start a supplement that helps improve blood sugar control and they stay on the same dose of insulin, their blood sugar could plummet and they could get a hypoglycemic episode. And that is something we always want to prevent at any cost. So definitely check your blood sugars more frequently if you're going to start a vitamin D or vitamin K supplement.